Today we're joined by Dr. Richard Gilroy, a hepatologist and medical director for the liver transplant program at Intermountain Medical Center in Murray, Utah. Welcome, Dr. Gilroy.
Thanks for having me.
At the conference, you presented a paper on ischemic cholangiopathy. And could you share with us a little bit what your findings were in that study?
So the paper is very interesting. Whenever we use a spare part, there's always the potential that a part of that part will fail. In liver transplant, the part that might fail are the bile ducts. And this study actually specifically looked at certain organs that are at high risk for getting problems with bile ducts, which are called donation after cardiac death organs. And they're people where they're brain dead, but their heart doesn't stop spontaneously, and you let their heart expire so that you can then consider them as donors. So this study specifically looked at what happens to people who receive those organs. And what it illustrates is there's an incredible opportunity of those organs. And when you look at the country, the United States, there is not a consistency in the use of these organs. So some programs use them and some programs do not. What does this study tell us? That more programs should consider using these organs because the outcome for those people who do get damage to the bile ducts is not as bad as we thought it might be.
Great. Tell us, who are your collaborators on this
This
study?
is a multi-center study. David Goldberg, Peter Abt, who are at the University of Pennsylvania, Chris Crom, who's actually at Mayo Clinic in Jacksonville, the guys at the University of Wisconsin. When you sit studies, or at least put together studies that involve multiple organizations, the data is more credible. Because instead of one of us having an opinion, it's all of us examining whether what we're doing is right. So you improve the quality of research, which is the goal of the International Liver Transplant Society, by getting collaboration together. And the International Liver Transplant Society's primary objective is to get people to work together to further the improvement in outcomes for those people who have been transplanted or for those people who are waiting on transplant lists for a liver.
Do you see the Congress spotting a lot of that collaboration, that ideas sort of are hatched at the meetings each year and that draws colleagues together? Yes,
it does. So what will happen with this, like as you saw with our presentation and as has occurred with other presentations at the meeting that we're at, what have we seen? One, we've seen some incredible discussions surrounding papers. And those discussions lead to ideas, and those ideas lead to new ideas that create opportunities to improve what we currently do. But further to that, if I see someone who comes up with a very, very good idea, the ILTS has presented me with an opportunity to walk up to that individual to get an understanding of where they got that idea from and to ask them whether or not they might be interested in partnering in developing that idea so that we can work out whether it will benefit patients and by how much.
Great. We'll look forward to what ideas come out of this year's Congress then.
There's going to be a lot.
Great. Thank you for joining us today.